Welcome to the business proposal presentation of the Future Strategy Division of WC Seoul. We will guide you through the details for a prospective combination drug, pembrolizumab plus cyclophosphamide in treating triple-negative breast cancer. TNBC is difficult to treat because it tests negative for antigens recognized by traditional targeted chemo. However, it can be treated effectively by immune checkpoint inhibitors because of its immunogenicity and its higher PD-L1 expression rate compared to other breast cancers. As PD-1 antibodies interfere with both PD-L1 and 2 pathways, a wider range of indications can be targeted. Also, in PD-L1 negative patients compared to chemo only, pembrolizumab plus chemo showed an effect, unlike atezolizumab plus chemo. TNBC clinical trials with pembrolizumab plus chemo are active. Expanding on this, we can expect synergistic effects of pembrolizumab plus cyclophosphamide and EMA approval following FDA approval. Let's take a look at the pharmacodynamics. First of all, cyclophosphamide is more immunogenic than taxane-type chemo because it effectively removes myeloid-derived suppressor cells. In addition, in macrophage differentiation, cyclophosphamide induces the M2 pathway, which has an anti-tumor function. Finally, with an appropriate chemo intervals, effector T cells increase and regulatory T cells decrease. Tumor debulking is also possible. Rather than sacituzumab, which is administered on specific dates in a 21-day cycle, pembrolizumab and atezolizumab, which is administered once in a regular cycle, have value as a combination formulation. Also, sacituzumab has a very short elimination half-life, not allowing enough circulating concentration to produce enough synergy with chemo. Pembrolizumab, which is administered every 3 weeks, and cyclophosphamide every 3 to 4 weeks, have an advantageous administration cycle. We named our combination drug Sospirula. Sospita is a Latin word for liberator, help, and savior, and Ire is the goddess of healing in Northern mythology. Ruda comes from Keytruda, which is well-known worldwide blockbuster drug. This represents our aim to help TNBC patients escape disease. Slogan, why so complicated, one shot is enough, emphasizes the convenience of administration and the sufficient anti-cancer treatment effect. Current treatments vary depending on cancer progression. For advanced TNBC with PD-L1 expressing cancer cells, the treatment may be chemoimmunotherapy. Immunotherapy market definitely is growing. However, there are no combination drugs in the market yet. And in the European Union, there are no authorized standard treatment regimens with proven benefit in overall survival to previously treated metastatic TNBC patients. In the market, there are 2 main competitive monotherapy biopharmaceuticals. Effectiveness targets TROP2. Because there are more TROP2 positive patients than PD-L1 positive patients, it maintained high sales. By 2029, there is a threat of sales and market share expansion. Atezolizumab introduced chemoimmunotherapy to TNBC, and this treatment is recommended by NCCN guidelines. Let us discuss the German market next. Germany's population ranks first in Europe and 19th in the world, and its female population is 42.1 million. In 2020, Germany had over 628,000 new cancer cases and over 69,000 new breast cancer cases. In 2019, the pharmaceutical market value of Germany was $4.14 billion, which is the biggest in Europe and is still growing. The anti-cancer drugs account for 15.6%, being the largest sales share. In terms of trade, pharmaceuticals trade, and ICH membership, Korea and Germany have favorable relationship towards this cooperation project. We conducted the SWOT analysis of Sospirula. Strengths include convenience of administration, better remission rate, and less side effects of chemo. Opportunities include only 3 competing drugs, high prevalence of breast cancer, and an advantageous triplet location. Weaknesses are not much clinical data because of its recency and low awareness of WC Seoul. Threats are high price, challenging market entry due to rigorous cost-benefit evaluation, and the scattered locations of university hospitals. We have integrated the SWOT points into 4 strategies. For SO, we plan to employ an evidence-based marketing strategy, emphasizing efficacy and safety. For ST, we expect that the effectiveness will compensate for the high cost. We further plan to give priorities to low CPS score patients for easier incorporation into insurance. Also, we will utilize cooperative relationships with Merck & Co. and hold joint webinars. For WO, we will overcome the low awareness by highlighting high prevalence of breast cancer. Also, we expect to accumulate more clinical data in Europe after entering the German market. For WT, we plan to establish a women-friendly company image to raise awareness of the values we pursue.
Now let's begin with the marketing goals. The targeting indication for Sospirita is recurrent unresectable stage 4 TNBC who receive prior therapies for metastatic disease. When patient CPS score is between 1 to 10, there are few competing drugs, so the market barrier is expected to be low. Therefore, we aim to occupy market share like this above. When patient CPS score is 10 or more, pembrolizumab and chemotherapy combination is recommended at the NCCN guidelines, so some competition is expected. Therefore, we aim to occupy a market share lower than the former. Let's move on to the marketing strategy, starting with STP. In Germany, there are about 2,000 hospitals and are categorized in 3 types, including public hospitals. TNBC occurs a lot in premenopausal women, especially women in their 40s and 50s. Immunotherapy is being used for TNBC patients who are PD-L1 positive. Since Sospirita is an ETC, we will target hospitals and healthcare professionals who have the right to decide which drug to use. Target public hospitals are in 7 regions. In particular, we should focus on Berlin because they are both the best and the largest hospitals. We targeted metastatic TNBC patients aged 40 to 50 who have had prior treatment. Since most TNBC patients' age are in this range, we expect to secure sales at a certain level. Since Sospirita is the first combination drug approved for the use of treatment of TNBC, it will be the leading pioneer of TNBC combination market. Emphasizing the convenience of administration over combination treatment, we aim to expand Sospirita's market share in the TNBC market. Now let's talk about marketing strategy specifically. The first is to target the insurance system. In order to be included in German SHI, we should target indications that have unmet needs and limited choice of drugs, such as low CPS score patients. Since Sospirita is an expensive drug, it is essential that the drug be covered by SHI. As we mentioned before, we classify target patient by CPS score. First of all, we target the low CPS score TNBC patient group. Afterward, we are going to target market with higher CPS score patients. The second strategy is to hold webinars. Through the webinar, we aim to visualize the advantages of Sospirita to cancer experts at target university hospital, which are scattered across a wide range of areas. Compared to offline seminars, both hospitals and WC Seoul can reduce the cost. The third strategy is to run a medication error reducing campaign. The goal is to give awareness that Sospirita is effective in reducing medication errors beyond simple convenience. As WC Seoul does not have enough recognition in Germany, we set 2 strategies to increase its awareness. One of them is to create a positive perception as women-friendly company, as TNBC is one of the cancers that only one gender suffers from. This image could be achieved by participating Berlin International Women's Day sponsor. The other way to raise awareness is to emphasize collaboration with Merck by inserting praise with Merck. Also, name of Sospirita reminds of Keytruda. Our final marketing strategy is to use the medical tourism business. Germany has a world-class medical tourism market. Since the options of medicine for our targeting patients are limited, Sospirita can be an attractive alternative for them. In this regard, to increase access, the company's website should provide various languages.
What I'm going to talk about is the last part of this presentation, risk management plan. Before we start, we set a guideline reader as healthcare professionals for some reasons. First, Sospirota will be approved as an ETC drug and injected by healthcare professionals. Moreover, the patient group we set as an indication of Sospirota is likely to be hospitalized for chemotherapy. To set a risk management plan, we analyzed similar withdrawal cases. Let's start with anti-cancer drugs. In 2011, FDA withdrew the combination treatment of Avastin plus paclitaxel because severe adverse events were reported. As immuno-oncology drugs try to expand indications, several withdrawal cases have happened. For example, in March, Tecentriq's conditional permission was in vain, and in July, Keytruda's accelerated approval was cancelled. This is because both have failed to prove efficacy in clinical trials. Let's move on to the combination drugs. Withdrawal was approved by FDA, but the same components Genhail failed to get EMA approval. It means FDA approval does not guarantee EMA approval. In 2014, Letrozet was recalled voluntarily because the problem of outer packaging defect was proposed. This can lead to drug safety issues and impact medical effectiveness or risks. Based on this analysis, we set a recall manual of Sospirota. If the following problems are identified, it is necessary to notify the EMA and take a recall action. Now, I will talking about safety-related risks more specifically. We choose three main risks of Sospirota, which are ADR, administration errors, and distribution risks, and then categorize them according to the ICH pharmacovigilance planning. First, we summarized ADR of cyclophosphamide and pembrolizumab based on clinical data. We checked identified ADR from Lexicomp and the report of Keynote 355. I'm not going to read every ADR here. Next, since Sospirota is administered intravenously, there is a life-threatening risk of medication error. We have listed the risks that can be expected to happen. These risks can be prevented by changing packaging, design of drug, or by human factor. So by using these points, we should establish a risk management plan. Lastly, pembrolizumab is a humanized monoclonal antibody, which makes it difficult to distribute and restore medicines. So the distribution and storage of pharmaceuticals must be strictly managed and proper cold chain delivery must be secured. Now let's talk about risk minimization measures. What I'm going to talk about now is based on the EMA guideline on GVP 2017. The first part is the educational program for healthcare professionals. Checklists can be used to go over the contraindications and drug interaction before the prescription. It includes research of lab tests, previously immunosuppressive therapy, vaccination, etc. Next, brochures will cover manuals and real-life measures of ADR. It is an effective tool to raise awareness of the expected ADR beforehand and aid in early recognition of those risks. Furthermore, posters can be used to illustrate the accurate dosing regimen, dilution or reconstitution method, and injection skills in the on-site administration of Sospirota. Another way to minimize risk is optimizing drug labeling and distribution. A strategic alliance with supplier is required to maintain the physiochemical stability of Sospirota. Also, it should be planned from the manufacturing stage the labeling features such as color and patterns of vial caps, concentration and dosage clearly printed on vial bodies. To identify the effectiveness of our RMM, the following parameters can be utilized. As process indicators, there are assessments of attitude and level of clinical knowledge through interviews, surveys, or questionnaires. Prescription records and drug utilization studies also can be parameters. As outcome indicators, there are frequency and severity of ADRs and safety outcomes measured through surrogate endpoints. This is all we prepared, and thank you for your time.